This is a Rogue Media Network podcast.
Hey, it's Christina.
Hey, it's Jen.
Hey, it's Kate.
Real Estate Misfit Moms.
Continuing on our health and wellness conversation, we have Sarah here, and we're wrapping up like our holistic look at our goals for the new year. So, wanted to bring in somebody who is it's an not up and coming, but it's something that's been around, but it's something that's becoming more vocal, more loud. People are hearing about it. I love that. And when you think holistic medicine, at least what I think of is probably from my childhood is people think like, oh, well, we'll light some incense. We're gonna have this seance and down the full moon and essential oils. That's what people think holistic is. Like, a lot of people don't understand what it is. So why don't you introduce yourself, who you are, what you're with, and what is holistic medicine?
Yeah. Well, I just want to go on record and say I've never performed a seance before, so I don't even know.
You don't carry crystals in your purse?
No.
Okay.
I don't.
No crystal
Sorry.
healing? No.
Yeah. But I am Sarah Campbell. I'm a physician assistant. I've been practicing medicine since 2012. And so I own 2 clinics. One is Waco Center for Functional Medicine, so it's a functional medicine clinic. We look a lot at hormones, gut health, nutrition, toxicity, so heavy metal toxicity, mold toxicity. Really, like, we consider ourselves like medical detectives trying to find the root cause of illness, symptoms, I mean, you could have a diagnosis, or you could just be feeling like crap and just feel like, what the heck is happening to me? I'm getting older and this is not okay. Our other clinic is natural primary care. So that is basically a primary care clinic where we believe in medical freedom. And so there's a lot of people who, especially after COVID, feel like they go to their doctor, but they're not listened to. They get kind of brushed off. They only spend like 5 or 10 minutes with their doctor, and they're just like, okay, that wasn't helpful at all, and now I'm frustrated because I'm having XYZ symptom, and all they want to do is throw a pill, and they don't want to listen to me, and they don't want to, think about some other alternatives that could be helpful. So yeah, we'll have those 2 clinics. Now we also have a location in Corsicana, so it's growing for sure. So
That's awesome.
Yeah.
And you're located here in Waco?
Yes. So the primary care clinic's here in Waco, and the functional medicine clinic is here in Waco, and then we have a location in Corsicana for functional medicine. So, yeah.
That's awesome.
Yeah.
So some of the things that I feel like specifically to moms, because that's what we talk about a lot is mom life and things like that, like are how things have changed from being like in our 20s and how we felt in our 20s. And I know part of it's aging, right? But I feel like the conversation about how much hormones affect our bodies, especially if you've had kids, and what times of your life you had those kids, how much that plays a part in just our function, like just being. So I've had more people, and they always tell you like, oh, it's always harder when you're older to lose weight because that's your hormones. But is there a way to counteract that? Or, more women I feel like are on anti-anxiety and depression meds that are, I don't know if it's now just more openly talked about, or is that something that it can be in relation to hormones and things going on in our body that we could counteract more naturally than taking something synthetic and putting something into our body.
Yeah. And, in functional medicine, at least, sometimes I feel more like a counselor than I do like practicing medicine, because we see so many women who come in and they're all feeling the same way. They're tired, they have brain fog, they're anxious, they have low libido, they feel like they never have time to themselves, they are like they've lost kind of who they are. And I think there's several reasons. Number one, obviously societal expectations, that we put so much on our plates and we expect ourselves to do so much and then bounce right back after we have baby. Just unrealistic things that we put on ourselves. And so I think that's a huge thing. And I know, I'm sure y'all probably going to have somebody come in and talk about mental health, which is, huge. But yes, hormones do take a dive because also we have baby, we're up at all hours of the night. We're, we aren't taking care of our stress hormones, our cortisol levels and things like that, which then affect our progesterone and our estrogen and our testosterone. And so the thing is that conventional medicine doesn't usually look at the body as a whole and how all of those things can affect hormones. So, when women have low progesterone, a lot of times the direct effect is anxiety. It causes increased anxiety and poorer sleep. So when someone's coming in and they're like, I'm tired, I'm not sleeping well, I'm anxious all the time, I'm always saying like, okay, well, your progesterone's probably low. So
That's me.
Yeah. Yeah. And also like
That's me all day long.
Yeah. And then you see, so progesterone and estrogen have kind of like a balancing effect. So estrogen is great, but it can be a little more inflammatory. Progesterone has a little more anti-inflammatory properties. So if your estrogen is too high or you're estrogen dominant, then you might have heavier painful periods, PMS, irritability, bloating, weight gain. And so if your progesterone is low and then your estrogen is too high, then that whole system is going to be exacerbated essentially. So, I mean, yeah, hormones are, it's a symphony. And I always say like happy hormones equals happy life.
I need some of those.
So yeah.
Is that something you can just go get some of?
Well, there is. I mean, there is
yeah.
bioidentical hormone replacement, which, there's a lot of clinics that do bioidentical hormone replacement. I would say you definitely want someone who truly knows what they're doing. We look at kind of like how you're detoxifying different hormones because people don't realize that you have to detoxify estrogen. So, and if you were to go to your OBGYN, if you were to go,
We have to do what?
you have to detoxify estrogen.
So
Yeah.
is that like how does your what
What does it
organ
look like?
in your
Yeah,
body
yeah.
do that?
Yeah. So, and I can go so nerdy, so I'm going to hopefully keep this on the surface. But, so you detoxify your estrogen in 3 different phases. The first 2 happen in your liver. The third one happens when you have a bowel movement. So.
And how long is that process? I mean, are we talking like a day?
I mean, it really kind of depends on your detox pathways, but probably every day.
That's
You're
It's like you
That's
ingest
like
something?
That's another.
But that
thing
means you
though.
would have to have a bowel movement every
there's
day.
so
Right.
many women
Yes,
that
there
I know
are.
that
Yes.
don't
No.
have bowel
Yeah.
movements
I think-
for like weeks.
For
I think all
sure.
3 of I think that we've all talked that like
Poop
Yeah.
camel.
yeah, like I don't poop very often.
Well, then no wonder why your hormones are messed up.
Girl, no, just my hormones are messed up.
It gets so deep.
But
Yes.
see, that's the thing, though. Okay, so you're not having bowel movements every day. Well, that's going to affect your hormone detox pathways, which is then going to cause, like, if you think about a traffic jam, like this exit 2 miles down the road is blocked up. So that's your phase 3 detox. Like it's blocked up.
Okay.
So then you're going to have a backflow of all these cars, your estrogen hormones. They're going to all be backed up. So then you're going to be even more estrogen dominant. Does that make sense?
Yeah.
So you might have those feelings of heavy painful periods, PMS, bloating, can't lose weight, water retention, irritability,
all those but the first 2.
Yeah. So
I'm like, dang.
yeah,
Well,
it's
and
like
the
a
thing
whole
of it is
thing.
you don't know that stuff until you know.
Right. I know.
I mean, you just...
I know.
Well, and I would.
People think it's just normal. I thought it was normal.
Yeah.
And that's the thing,
Right.
because
Yeah.
you talk to other women, and other women are like,
Yep.
"Oh, I have that." So then you think,
Oh,
"Oh, that's normal." Oh,
Yes.
okay, that's what
Yeah.
it's like. It's like this after having, after having a child. It's okay to cry at Sky's story in Paw Patrol while breastfeeding.
Yeah.
But maybe that's what happened. Hey,
I
you know,
love
she was
it.
very sad.
You are
But-
postpartum, and
Yeah,
nursing
but-
that can be somewhat
But
normal.
but it's similar. But then I remember after I had Everett, my second kid, they wanted me to go back on birth control, and I was trying to breastfeed, and I had read so much so many doctors told me it's not going to affect your milk flow, but I couldn't breastfeed my first child, so I was so determined to make that journey happen. For me, I wanted it, and then I started taking the birth control, so I was afraid of getting pregnant right afterwards. They tell you you're super fertile. So I was really afraid, but I was a insane psychopath, instant rage, all the time, which I was like, I haven't changed anything other than starting birth control. So I stopped taking it and the rage went away.
Yeah.
And my husband was like, "Oh, there you are." Because
Thank you.
I mean, rage I have never felt. I could feel the heat rising. And I was scared of me. I don't know what I was doing to my kids, but I was scared of me because I was like, "Who are you?" And so I just have never taken birth control since. And I refused to take birth control because I got put on birth control when I was 15.
Yeah.
Yep.
Because
Yeah.
I had heavy periods. I was bleeding through my uniform. I had horrible migraines. And so I wonder, is there a bigger part to that is getting like brushed under the rug?
Oh yeah, for sure.
That, it's just like, it's the pandemic of we'll throw a pill at it.
Right. Yep.
So is there a better way to open these conversations, even at a teenage age, about female health that maybe a regular doctor isn't willing to have?
Oh yeah, for sure. Because I mean, the number one thing typically, like you said, like heavy periods, painful periods, what an OBGYN is going to say to you is like, okay, we'll take birth control, because basically we're shutting down your brain and your ovaries from, we are giving your body estrogen and a little bit of progesterone, depending on what you're taking, to trick your body into not having a normal cycle of hormones. And so we're going to just suppress all natural hormone production. So you're going to take this birth control instead of figuring out, well, why are your hormones kind of out of whack in the first place? And there is a Dr. Jolene Brighton. She has a book called Beyond the Pill. It's really interesting. Talks a lot about birth control, what it does, and post-birth control syndrome and things like that. And so that's a really great resource. And again, like I said, most OBGYNs, the stuff that we talk about on a daily basis in functional medicine when it comes to hormones, they have no idea. They have no idea that you have to detoxify in 3 different phases. I mean, they're not thinking about that because, their goal is to prevent cancer and treat. And two, like they're looking at it like, okay, are you dying? Are there like really severe things that we need to make sure that you're not suffering from and things like that. Like, not throwing shade at them. It's just that, that's what they've been trained on.
Their focus is different.
Their focus is a little different. And so I do think it's a kind of a new thing. But I mean, also gut health, that's a huge thing. Gut health plays a huge role in hormones and stuff. And so, and just kind of mineral balance, B vitamin deficiency. Like if your gut is leaky and inflamed, then you're not going to be absorbing these nutrients. And if you're not absorbing these nutrients, then you're not going to detoxify well. And if you're not detoxifying well, then your thyroid's going to be off. And if your thyroid's off, then your hormones are going to be off. So, again, that's kind of how we look at like the whole system's approach to the body of like what's actually going on beneath the surface. So
besides hormones, what are women most deficient in?
Sleep.
Yeah.
I would say sleep is a huge thing that we see a lot of. I mean, so many women come in and, or they may think that they're sleeping okay, but when they wake up, they're like, I'm not well rested. I feel like I could sleep a few more hours. I will say magnesium is a huge thing that we see tons of people deficient in. Yeah.
But have you done anything about it?
No, because there's too many options.
Yeah.
Like,
So
are you supposed to spray it or take it or we have bands on it or like there's
do you need
too
something to
we have a
make it work
group chat and we're
better?
like, everyone sends something. I'm like, cool. Can someone tell me what to buy though?
Right.
Like,
Yes.
what do I do?
Yeah, and there's a lot of options. There's several different kinds of magnesium, and each of them do different things. So magnesium citrate is great for constipation.
Ooh.
So
thank you.
maybe you might need that one.
Her too over
Tip
there.
1, magnesium threonate is one of my favorites. It really helps with sleep, anxiety, things like that.
Is that something you can just go buy?
Yeah. Mm-hmm. It's
Like
over
at
the
CVS
counter.
or whatever?
Yeah, it's over the counter. Obviously, if you have kidney disease and things like that, like check with your doctor first about like how much to take and all that kind of stuff, because there are things.
Is it something they could learn from you? Like, could we come to you and you would tell us, hey, these are the things you need to go buy. This will help you?
Yeah, usually kind of what in primary care, kind of what we do is like, okay, these are all the symptoms going on. Okay, let's start you on this, this, and this. Here's, some diet changes, things like that. Let's get some labs, and we do like a pretty substantial panel.
Yeah.
And then say, okay, let's come back in 4 weeks, see how those supplements are doing, see how the diet change is doing, and then go over your labs and then kind of make some tweaks and things like that. But no, yeah, I mean, so and that's the thing that's hard because there's so much information out there. Like you said, there's so many different kinds of magnesium. There's so much information. It's like, what do you do?
Social media kills you. Like, it floods you. Like, you said cortisol earlier, and I'm like, my brain automatically went to all those people on TikTok talking about all the stuff you needed. I'm like, I didn't even know what that was. Like, I am 34 years old and feel like the biggest dummy about my health, my wealth, my mental health. I'm struggling.
But I feel like that's part of the reason why I wanted Sarah to come, because I'm just like,
genius.
Well, I don't know about that.
But I mean, it's a different way to look at your body, and I think it's so good to look at your body as a whole, as opposed to like, you know, when like you go to the OB, they're only looking at your your lady bit, and like you go, like you're put onto a shelf. It's like the lady bit doctor and the like gut doctor and your main doctor that you go to like get a sinus infection, I need antibiotics,
and your pain doctor,
and your pain doctor, your like if you have cancer, like that doctor, and you might have 4 of those kinds of doctors, and so it's, instead of being put on a shelf, because if you try and talk to your OB about like your migraines, they're probably not going to connect some of the dots. But like when I personally don't menstruate when I'm breastfeeding, but when I do and I know a period's coming, I get a migraine almost every time. Yeah. And it's debilitating. Like I go blind in one eye, like they're bad. Like,
and that can be several different triggers. Like some women who have migraines prior to the period, it's like, okay, so when? Is it the week before? Or is it like the day of? Like, because some women get migraines when all their hormone levels drop. So their estrogen drops and their progesterone drops and they get migraines. Other women, that week before their period, kind of when estrogen and progesterone are rising, because of it, possible imbalance in estrogen and progesterone, that's what triggers migraines. So, you know, again, I ask a lot of detailed questions. Okay, when in your period, like when in your cycle, because your hormones are constantly fluctuating throughout your cycle. And so those things can kind of give clues as to what could be a cause, but it probably is hormonal if it's, you know, every time, you know.
Because, I mean, everybody's cycle is super different, obviously. Yeah. And so, like, I've tried to look up stuff, too, like, because I just had migraines last year, or earlier this year. I was hospitalized twice for them. Kate saved me one day, took me to the doctor, literally drove me to an ER because I couldn't drive myself. And because I had tried to self-medicate at home and try to take care of it, it didn't work. But, so I tried to, like, look it all up because, like, I cycle for 2 days, and I'm done. 2 days. Max. Yeah. Like, and so it's always like different, you know, but like my little app tracker on my phone will tell me exactly when it's going to happen. Right. But like my migraines weren't anywhere near my cycle. It was just like this random ass time. And now my doctor has me on new meds. So.
Yeah. And sometimes they're not related to hormones at all. It could be something else.
Yeah. He thinks it was stress related.
Yeah. Yeah. That could definitely. Cortisol.
Cortisol. I'm going to have to Google that.
Yeah.
Can you tell me what that is?
Yeah. So cortisol is our stress hormone. So basically, it's our stress hormone. It rises when we are very stressed. So we need enough cortisol just to sustain life. It helps with blood sugar regulation, energy production. Obviously, it plays a role in, you know, hormonal production. But the problem is these days we're always stressed. We're stressed and anxious. But the body, you have to think about the body as like a primal being, right? So like when we're stressed out, the body as like a primal thing thinks like, oh my gosh, she's stressed out. Her life must be in danger. She must be running from a bear, right? Fight or flight. It doesn't realize that you're stressed out because you have to get this kid here and that kid there, and then you have to pick up the groceries, and then, oh crap, I forgot about, you know, I'm supposed to bring the cupcakes to the thing, and then, you know, like you're trying to fit all these things, or you have financial stress or whatever it may be. It's not thinking like, oh, well, she's safe, she's not actually dying. It still perceives it all the same.
Okay.
Interesting.
So the fight or flight response. Now, because we live in a society that we have that sustained like fight or flight all the time, usually. And our body just can't keep up with that on a daily basis for years and years at a time. So eventually what we start to see is like cortisol depletion. So like our cortisol starts to kind of drop over the time where it's not able to, you know, do that sustained normal rhythm that it's supposed to. So then you start to have like afternoon fatigue. So 2 or 3 o'clock in the afternoon, you're like, I need coffee, or I need a nap, or, you know, brain fog, or blood sugar spikes and dips. Like a lot of people who have like, we call it like adrenal fatigue, which, you know, they say is not a real thing, but you know, I've talked to thousands of patients, it's real. It's just not like a condition that you need to see an endocrinologist for. But you know, blood sugar dysregulation, so your blood sugar drops really easily. You wake up in the morning and you're just dragging still. So there's a lot, again, And those are the things that people say, well, you're just getting older. That's just a part of
Yes.
life. You're a mom. You're getting older. It's normal. I'm like, but wait a minute. Like, I have patients who are 60, 65, and they're running circles around my, like, 32-year-olds. Like, no, like, you can't tell me that. And
Is it because we're missing the education point? Like, we're not, as a society, being educated enough about that, like, there is other ways to take care of your body besides just going to see your primary care?
Well, I think so, yeah. And I think it's just, again, kind of back to that societal norms and expectations. Like you said, you talk to all your girlfriends and they're all tired and stressed and their periods are a mess. And so we just think it's normal.
Yeah.
And we don't know that there's another option, you know? So, yeah, I think that we don't know there's another option. That's why I'm so passionate about, like, educating and things like that, because I'm like, you don't have to feel this way. Like,
Yeah.
you don't have to feel tired and worn down and miserable. And so kind of what we do is we kind of see, like, okay, what kind of pattern, like cortisol pattern, are you doing? And there's different herbs and supplements and things like that we recommend. They're called like adaptogen herbs that kind of help to support the adrenal glands,
Those
to
are
kind
really
of
popular
balance.
drinks right now for people that are
Yeah.
not trying to drink alcohol.
Yes,
Not me,
yeah.
because I'm breastfeeding, and
Right,
some of those are not good for breastfeeding.
right.
I like to drink
Yeah.
alcohol.
I think I had one of those. Now that you say that,
Recess is one of the big brands.
a friend of mine gave it to me. She said it was like a little can,
Mm-hmm.
and she was like, 2 make me really sleep at night. And I was like, well, I don't know if I can drink 2 or 3 of them. But
Yeah.
is that what those are?
Well,
I
no,
didn't-
I mean,
like,
what
what do
we
you buy?
recommend is like, it's like capsule, like supplement capsules. Actually, I have my little baggie of supplements right here that I haven't taken yet this morning. That has some adaptogens in it. But no, yeah, so those are drinks that you can drink that can help. I mean, kind of what we recommend is like a daily, like you take it in the morning. It's a daily regimen. Yeah. And, you know, when it goes back to like anxiety and depression, and so many people are on these meds, and it's like, well, it's not like you don't have a Zoloft deficiency, you know, like, so what is causing your anxiety and depression, you know?
Lack
so,
of meds in my body today. I did take mine.
Yeah.
I
So-
do forget to take mine sometimes, and then I notice. Like yesterday, I didn't take it, and by the afternoon, I had a headache, and I was like,
Yeah.
maybe I should
Which-
take these.
and
And I
that's
was
the
like,
thing, like-
no thanks.
And that's what
okay.
we believe. There's like, God gave us Western medicine for a reason. Like, we need to use it.
Yeah.
But also, like, we can use it while figuring out, well, why does the body need it in the first place?
Yeah.
You know, and of course, there are diseases like, yes, you need medication. Stay on that medication. If somebody comes in, their blood pressure's crazy high, we're going to put them on medicine. We're also going to put them on magnesium glycinate, which is a type of magnesium that's great for blood pressure and digestion and things like that. But, you know, that's kind of how we look at it, is like, why are you deficient in these nutrients? Why are you needing these things? And then kind of work backwards to work on the reasons why.
I love
So,
that.
yeah.
I do like that. I mean, I
Yeah.
feel like that's what people have been craving and didn't know where to get it. Like,
Yes.
and I think because of COVID, people were looking because people were afraid of the vaccine,
Yeah.
and now there's
Or even going to the doctor. They
even
didn't
going-
even want
they
to
were-
go to the
No
doctor.
one wanted
Yeah.
to go to the doctor, and then then it was the after effects of COVID, like people who have long COVID and people who have these things, and did they do the vaccine or not, or did they take I don't even know the name of the drug that they give you if you get COVID now. It's like it's like what you get for the flu, but it's for COVID. It's supposed to lessen your symptoms or something.
Paxlovid.
Yeah, but people are unsure of that drug, and so there's just so many things that I think people are afraid of, and people were looking like, I mean, how many people stocked up on elderberry and their vitamin C?
I had never even heard of things like that
and
before. I
like
hadn't.
had a COVID box like full of like
Yes.
minerals and vitamins and things that you find in nature, as opposed to calling your doctor, because your doctor's pretty much like, unless you can't breathe,
Right.
don't come see me.
Right.
And
yeah.
so, I think that now it's been a great thing for you guys, I think, because it does give someone like another avenue to talk to somebody.
Well, and that's why we went into medicine in the first place. And so, like, my team has grown. Like, I have 3 other PAs that work at our clinics, and so many practitioners are burnt out because they went into medicine to help people. And what they're finding is like, okay, I'm just basically like dishing out a pill for every ill. Like, I'm they're not getting better, you know, like I give them a pill, now they come in with another thing. And so then now I have to give them another pill. And like, they feel like they truly can't give them answers to what's actually going on. And all they can do is refer, you know? And so then,
true.
So then we get people who come in, especially like our primary care clinic, and they come in, they're like, I've been referred to 4 different specialists. Like, you know, I don't know, but I don't feel well. And so then we listen to them, and it's like, okay, well, let's start these things. Let's give your body like the nutrients that it needs, and then kind of work on some lifestyle things. And like I said, a lot of times we're counselors, because it's like, okay, what's actually going on? Like, what stress-wise is going on in your body?
Because you want the underlying.
Better. Yeah.
You want to find the underline of it.
Because there's a source somewhere.
Right.
Yeah.
Exactly.
Even if they're like, no, I'm fine. There is something triggering all of those.
So our body is basically like a big chemistry experiment,
Which,
and like our beakers are like not
Yeah.
balanced, right? So like we're dumping too much in of one.
Of stress, toxins, you know, you name it. And that's, you know, my goal is for people to understand how their body actually works. And that's another thing, is like everybody's body is individually different. We are all genetically different. And the thing is that, you know, a lot of reasons why people say, oh, well, functional medicine and whatever, it's hogwash, because you don't have a double-blind, placebo-controlled study on whatever, you know, you're doing. And I'm like, yeah, that's because your study is an N of 1. Like, each person, like, is different. Like, you're different from me. I'm different from you. So you can't do a whole study, you know, in my opinion, on some things that, you know, to see what is helping. So that's our goal, is to look at each person as an individual, because what someone may respond well to, like, someone else may not respond well to. And so,
do you see children? Like, so my daughter is 7, and she has severe anxiety about life, everything in life. She doesn't poop. She also has very bad diet, because she will not try anything because she's too scared to try anything new. So do you see children and do things like that to help parents, like help get them? I can't get the words out. I don't know what I'm trying to say.
Yeah, so we see children. We see them in functional medicine. We also see them in primary care. And a lot of times with kids who have, like, it's basically like sensory issues. You know, like we see like sensory processing disorder and things like that. And, you know, food allergies are at play. Gut health is at play. What we see a lot is typically kids who've been sick a lot or on antibiotics a lot, or they're, you know, they tend to have more sensory issues, more gut issues, like not, constipation, not pooping, things like that.
She is healthy.
Yeah.
Which is the weirdest thing ever. But, like, and I've taken her to a speech therapist. I've taken her to a regular therapist. She's seen a dietitian. They're like, try to add these things. I'm like, where do you want me to add those? Because she won't eat that.
Yeah.
Like, my kid eats 5 peanut butter sandwiches a day and loves it.
Right.
Here we are.
Yeah.
But she's also been through. You guys have been through a lot.
Just, but that all started before. So what you don't know, my husband had cancer last year, and he's in remission. And so that played a big role in who, like, she was attached to, which was me, because she thought I was going to die.
Yeah.
You know, she thought dad was sick, mom's going to die.
Right.
So, but before that, her eating changed. And so she has been my non-eater for years. And she'll tell you, I stopped eating at 2 because she's heard me say it. Because doctors will ask, like, well, when did she stop? And I'm like, around the age of 2, my child has never had meat in her life. Never. Would never even, like, lick a chicken nugget or eat a chicken nugget. Like, girlfriend was happy to not get a Happy Meal because all she wants is the fries. Because I stopped buying them when she wouldn't eat the nuggets. I'm like, I'm not buying you a Happy Meal for a toy and a fry.
Right.
You know, and so, like, my thought process on this is, like, okay, can I come see you and then my kid come too? Because, like, we obviously both need to see you. We both have some issues.
And the thing that's hard, too, with kids is, like, they don't know any different, right? Like, she may never complain of her stomach hurting because
she does all the time.
Oh, she does.
All the time.
There you go.
Do you want to know her favorite thing to eat before she goes to bed is? A Pepto. Girlfriend thinks it puts her to sleep. It doesn't.
And here's the deal. So, like, we see so many gut infections. So, like, it's an advanced stool test, which looks for H. pylori, yeast overgrowth, bacterial overgrowth, parasites. And it's interesting because I get some patients who they're like, I don't really have any, like, gut complaints, and then we get their stool test back, and I'm like, oh my gosh, you have a bomb went off in there. You got yeast overgrowth, you got 2 parasites, you got H. pylori, like, it's a You know, and parasites are way more common.
Yeah.
Than
Is that what you hear them talk about? They're drinking something and these worms are...
Yeah, that's...
Oh.
Is that true?
So, yeah, no seances involved on the full moon with, like, the worms.
The worms in the jar.
Yeah.
Where they're drinking something
Yeah.
and then...
So, yeah,
It's
I mean...
like a cattle dewormer.
It's like, it
that-
freaks me out.
Yeah, you
Yeah.
get it at the feed store. People literally would go to the feed store, especially during COVID. They were saying, oh, now I can't remember the name. It's
Ivermectin.
Ivermectin.
Ivermectin, they would take it.
Because we have some, because we have horses.
Mhm.
And people would say, were calling us saying, "Do you guys have any left?" And we're like, "I'm not giving that to you. What's wrong with y'all?" Like, I'm not going to be on the hook for you taking
I'm
whatever.
not your doctor.
Well, I
People
mean,
were-
so we use ivermectin to treat several things like COVID.
And see, a lot of people
and
did.
A lot of people
we use it to treat like Lyme disease, reactivated Epstein-Barr, and actually we discovered that it was helpful for that because we were using it for COVID. And then I started to see a lot of my Epstein-Barr patients go into remission. And so anyways, that was
Interesting.
yeah. So
What do you mean into remission?
So this is a whole another thing. So
The
Epstein-Barr.
reason I ask is because my husband got cancer from Epstein-Barr virus, EBV.
Oh, really?
He-
Was it like a head and neck cancer?
He had nasopharyngeal carcinoma, so he
Yeah.
had a mass,
Yeah.
multiple masses in his nasal cavity where all the fluid just came out of his nose, and he had cancer in his lymph node,
Yep.
this side in here,
Yeah.
and so they tested him, and it was part from EBV, and
Was there
so
cytomegalovirus as well?
I have no clue.
Yeah.
I just
That
know
one's
that
also-
the biggest thing they kept saying was Epstein-Barr virus,
Yep.
EBV,
Yep.
because our children now have to be tested for it.
Yeah, so Epstein-Barr is a huge thing, and a lot of doctors don't even think about it, don't even test it. So Epstein-Barr virus causes mono.
Yes.
So 95% of the adult population has been exposed to mono or has it present in their bodies. So this virus is very similar to chickenpox. So when you're a kid, you get chickenpox, that virus stays dormant in your spinal column. Later on in life, when you get stressed and things like that, that virus then reactivates and you get shingles. Epstein-Barr is similar, but so when you get it as a kid, when you have mono, or maybe you didn't know that you had mono, that virus stays in your body. Later on in life, it can reactivate. But what it looks like when it is reactivated is very subtle. It looks like brain fog. It looks like fatigue, migrating joint pains, muscle aches, sometimes autoimmune conditions, thyroid stuff. But you know, so it can reactivate and it can kind of do all kinds of things.
Yeah, his was like EBV and like a skin cell because of like where it was.
Yeah.
I don't know. It was
so,
a lot.
And yeah, they're finding a lot of viruses are the sources of cancers and things like that. So we do a lot of that, like looking at viruses, lowering viral loads and things like that. So
Because both my kids now have to be tested for it because like the cancer he had was super aggressive and the treatment was very aggressive and very fast.
yeah.
And so they're like and so now he gets scans every 6 weeks right now and PET scans twice a year. And so like it's a lot just
Yeah.
to make sure it doesn't move or because it grew so fast. They think it started in January of last year.
Wow.
And by May, he was in there in the nasal, like in ENT having a biopsy done to see if they could just remove it because they thought it was anoid tissue. You know, and so that's how aggressive it was. It was quick.
Yeah.
And so now it's like, well, now you don't hear a lot of people talk about EBV. And so when I've said it, people are like, what? I'm like,
I've never heard of it.
it's Epstein-Barr virus, which is a part of mono. People are like, what? I'm like, I don't know. I just learned it.
Yeah.
Do I know a lot about it? No.
Yeah.
But I know, like, pieces. I know the pieces I need to know.
Right. Yeah. Yeah. And it's a lot more common
Yeah.
than, we realize. So I had reactivated Epstein-Barr. The way what mine looked like was acute onset. I started having like just muscle aches. Had no energy, brain fog. Like it felt like my body was like lead weights, like just walking around every day. Felt like someone had taken like a wire bristle brush and like just scrubbed my muscles basically.
Oh my gosh.
Yeah, I felt like I've been hit by a bus whenever I woke up in the morning. So that's kind of what. And sometimes people just think that's part of normal life, I guess,
I think a lot of people
I think we
that.
all think that.
Like,
Yeah.
muscle pain, body aches. Like, I think that we all think that. Like, obviously, Kate thinks that because she's right now standing with a baby and she's sore. But you're sore because that's what you're doing. But you're also sore all the other times. But you also have funky positions and you sit funky.
Right.
But it might not be normal. Maybe you should go see her.
Who is a good candidate? That's my question. Is it like
Everyone?
anybody? In my mind, that's what
Yeah.
I'm hearing.
Yeah.
Do you see?
I mean-
do you see men too?
Yeah, we see men.
Men, women, children. There's
Men,
no
women, children.
Okay.
Yeah.
Everybody.
Yeah. Everybody. Yeah.
Do you take insurance?
No, we don't.
Okay.
Yeah. And the thing is that in order for us to take in, the way that insurance has become, it's like you have to see 25 patients a day in order to make enough money to keep your doors open.
Yes.
And
How
I'm
can
like,
you
I
do
don't.
that and truly listen to your
Exactly.
patients?
which is why you're in and out
Exactly.
like cattle.
And that is, I'm
Yeah.
like, and when we created our primary care clinic, like the max number that my providers see in a day is 12, because
Wow.
That's awesome though.
I want them to be able to, first of all, I don't want my providers stressed out and feeling like, oh my gosh, like
I
I'm
can't
going
keep
from room
up.
to room, I can't keep up, I'm drowning, because then if they're stressed and they're not feeling good, then that's
Right.
going to affect the quality of care for patients.
Yes.
Of course.
And I've been there before, and I've been just a cog in the machine where I'm seeing 25 patients a day, and I'm miserable, and I hated it. And I don't want that for my providers. And number two, I want my patients to truly feel like they've been heard and listened to. So to answer your question, yeah, I mean, and that's why we have primary care, and that's why we have functional medicine. So functional medicine is it is a lot more expensive because you're doing a deep dive. Some of these tests are expensive, and they're not covered by insurance, which, that's a whole nother thing. So like if you want to do a deep dive and really kind of reverse like chronic illness and autoimmune thing, I mean, I don't say reverse, I say improve them because I never say like we cure anything,
Yeah.
then, that's functional medicine. Primary care is more like we have these conversations with all of our patients, and it's like, okay, if you want to feel better, obviously we're not going to get you, perfect, but
Get you on the right track,
Get you on
too.
the right track, yeah. So so anybody who is having health questions, they feel like they're not getting answers, they want to, I don't know, have
Yeah,
other
so-
alternatives. So
I love that though.
One of my other questions is like, what does it look like to set up an appointment? Do we just call the office and say, and do we have to have an ailment, or is there just
No.
like I want to establish care? Like
Yeah.
that's like I just want to establish
yeah.
where am I at? Like what
Yeah.
am I looking at?
Yeah. For our primary care, you can call up, establish care, because also we do sick visits. So it's like I have a sinus infection, or I think I have strep throat, or I have an earache, or I screwed up my knee, like we do acute care visits as well. So yeah, you call, set up an appointment. Our intake form, you'll fill all that out, and then like our providers will look at it and kind of that'll guide the conversation and questions that you have and things like that. So you call the office, schedule an appointment. Our website, like it, I think there's like you can schedule an appointment on the website. We try to make it easy. We also have texting. So a lot of doctors' offices, you can't text them, but you can call or text us, which is really
That is cool.
convenient.
Yeah.
Does it understand talk text? Because
Because mine's bad.
I don't always.
Yeah, mine's bad.
If okay, so we had somebody come in to one of our brokerages and talk about kind of like this, but it wasn't like all the good stuff. It was like a new way for healthcare, and they charge like so much a year or monthly.
Yeah.
Is that how like y'all? How do you go about your payment? Like, is it
Yeah.
one time every time you come in, or is it monthly? Is it like your own personal insurance with you, or?
Yeah, so our primary care clinic, it is options. So you can either pay per visit or you can do the membership.
Okay.
So like you're probably talking about direct primary care or, membership model. So if you choose to be a member, you pay like a monthly fee, and all visits are included. You get discounts on supplements and things like that, labs. And a lot of times with our membership patients, like we do things over the phone if we can. You know, it's like, hey, Susie has a rash. Can I send you a picture? And I look at it and like, oh, okay, yeah, you just need to do this. Or come in, I need to take a better look at that, or whatever. Or let's say they just want to, hey, I think they may have strep. Can I just come and get swabbed real quick? They come in, get swabbed, leave. We call them with the results. So it's just a little bit more convenient, easier access to care and things like that. Or you can do the pay per visit.
Blended, right? So it's not just every time it's going to be like, here's your minerals and your herbs and stuff. Like,
right. Yeah.
You can get antibiotics.
Right.
You can get pain medication.
So when someone has strep throat, I'm like, you need an antibiotic, because the risk of not treating strep throat is way worse than like the antibiotic, in my opinion, because it can affect the kidneys and the heart and things like that. So yes, Most definitely, we blend Western medicine with natural. You know, we prescribe things, but then we also offer natural options too.
That's what people are afraid
Right.
of, is that
Yeah.
they won't have access.
Right.
Like it's one
Yeah.
or the other. They have
Right.
they're in
Yeah.
this bucket or
and,
that bucket.
and a lot of times, a lot of what we do is like, hey, let's have a conversation. Here's your options. What do you feel most comfortable with?
Yeah.
You know, we have option A, option B, option C. Let's talk about it. Let's talk about what that looks like and what you feel most comfortable with.
Because there's a lot of people that don't have insurance either, that this would be a really good source for them,
Yeah.
because then it's not as expensive, because we pay hundreds of dollars.
Right.
I personally, like, my husband just got a new job and now we're off of individual plans. Like, we all had individual. We were paying like $1,400 a month for individual. And I'm like, oh
And
my
your
gosh.
copay or
And
your
you still have to
deductible's
meet your
huge, probably.
deductible.
Yes,
and-
and it's massive because it's individual, because having a family plan was so expensive for us. We're like, it's not worth it.
Right.
So I just want to make sure that it's the availability is there, because there are so many people that don't have it, especially 1099. Don't
Yeah,
like we all, if you're not married to someone with a W-2, you're screwed. You got to
Yeah.
pay for your own insurance.
Right. And what our family does is we do Samaritan ministries. And I know there's a lot of like Christian cost sharing ministry or like, you know, plans out there, but we like it the best. We've tried some of the other ones. This one for us has worked the best. Basically, you create a need. So for instance, my son had to go to the ER last year. It was $1,600. We paid self-pay. It was $1,600. We created a need for that ER visit. The maximum amount that we paid towards that was $300. And then other people in the ministry send us checks to pay that other $1,300 to
That's a
the
really
ER.
beautiful thing. I didn't
And
know that.
we
Yeah,
only
that was a
we
thing,
pay
yeah.
we pay $550 a month for all 5 of us.
Yeah. Wow.
Yeah. Now, I don't think they cover pre-existing conditions. So, like, you know, for people who've had pre-existing conditions, that is an issue. But for families,
That's,
you know,
that's a
it's
good,
huge.
yeah.
And we've had patients where they will also cover like 3 months worth of supplements, and they've covered some of the functional medicine testing and things like that we've ordered. So it's been really friendly for us as a family and some of the patients that we have that
That's
use
cool.
it.
I love that.
Yeah, I didn't even know that was a resource. That's awesome.
Mm-hmm.
Yeah. So
I've heard of it. And when my husband had cancer, he didn't have insurance. He was in between. He had lost a job the year before, made a change, became a realtor, and didn't have insurance. So we self-paid all of
Yeah.
cancer.
Yeah.
And then like the biggest medical debt of my whole life.
Yeah.
You know, I could buy a house with the amount of debt we're in.
Right.
Yeah.
And it still builds, but he was able to get insurance this year with a pre-existing condition. And now he's got a W-2 with insurance. But like, it would be, even a plan like this, we would have looked into it, because it would have made sense for
Right.
us. Especially the fact that you have knowledge on EBV, because his doctors don't have knowledge on that,
Right.
minus his
Yeah.
cancer doctor.
And I think
Right.
so many. I think there. I mean, I will say that like my dad's oncologists and things like that were amazing.
Yeah.
But I always think there's a reason why your body created something toxic in
Right.
your body.
Yep.
Like cancer. Like cancer's a toxin.
Right.
And there's a reason why it came, and you know, there's a lot of people that are talking about like it's because of the food we eat. It's because of you know, you need to be on this fad diet or the primitive diet or the paleo
Yeah.
diet or keto, and those are the only ones I know. But I'm sure there's a bajillion others, right?
Yeah.
Or like for a while it was you should only buy organic. Like that's how you eat clean, or you have to be a vegetarian and you can only eat these kinds of meats if you are going to eat meat. And you know, the access to that food is not always there. I'm from Virginia, so I had a lot more access to like not farmed fish, not frozen, pre-frozen fish. Like I just had a lot of differences. So coming here, people said I was like a snob because I won't buy fish here. Like I just won't eat it, and I ate fish majority of the time, and I won't eat it here. And the access to organic or healthier stuff, I feel like in our territory is harder than it was.
And
where
it's so
I'm
expensive.
from. It is very
So
expensive.
if you can go from paying all this extra money for organic food and stuff and flip it to where you're taking care of your body, then you don't have to like feed yourself the organics and have all this others just to make sure you're like super healthy.
Yeah, and I mean, I think that, you know, it's a balance, right? You know, like, because sometimes buying organic and stressing about every single thing and ingredient in a label is sometimes more toxic than the stuff that you're avoiding, you know, because I fell into that like a few years ago where I was like reading all the labels and like, oh my gosh, we can't have this because it has this ingredient. And then, you know, like literally stressed myself out over trying to make sure everything was as clean as possible. And then I'm like, wait a minute, like, this stress that I'm experiencing right now is sometimes more toxic than the toxins that I'm trying to avoid. You know what I mean?
Yeah.
So like, I feel like there's a balance, but yeah, I mean, the liver, and we talk a lot about detox pathways in the liver. Like, the liver is the biggest detoxifying organ, and we're inundated with toxins all the time, all day, every day. And that our body can store those toxins, like even toxins that we were exposed to as a kid, sometimes are still stored in our tissues. And so it's a matter of, again, like taking care of the liver, supporting the liver so that it can flush those things out. So like you said, if we're not able to buy organic, we can, our body can still handle that.
Yeah.
So yeah, for sure. It's definitely a balance.
If you'd like to learn more about what Sarah has to offer, please check out her website. You can find it in the description of this podcast, and we hope that you enjoyed this.
Thank you so much.
Bye.
Christina's
You made me
like,
laugh because I was like,
this has been Real Estate Misfit Moms. Don't forget to follow us on socials at Real Estate Misfit Moms and bookmark our podcast so you never miss an episode. Remember, miss, you fit in here.
This has been a Rogue Media Network production.